Radio 44 is commemorating World Heart Day. We have a special guest in studio, Dr. Hasham Varwani. Good morning.
Good morning.
Nice to see you. You are a consultant cardiologist at the Aga Khan University Hospital, right?
I am, thank you.
So you know what you're talking about when it comes to hearts.
That is true. But let's get into it. What is World Heart Day and the theme this year and its relevance?
So the World Heart Day is a global initiative mainly driven by the World Heart Federation, just mainly to create awareness of heart disease, the seriousness of heart disease worldwide. The theme this year is about harnessing the power of digital health to increase awareness, to help in management and prevention of heart disease. And this is kind of what we're already doing here, right? Talking to the masses, informing them what is important about your heart, how to prevent heart disease, but more importantly, how to recognize when you are having a potential heart disease and to seek assistance when that's needed. The catchphrase for this year is connect with the heart.
Right, connect with the heart. I like that.
That's quite smart.
Yeah,
that's quite smart. So we're right on theme with the whole awareness through digital media as well. So we'll be talking all about hearts. And if you have any questions as well, any concerns, you can send them over just so we can be guided through what problems the community is facing when it comes to heart disease. Yeah. If you didn't know, it's World Heart Day.
Yes.
Your heart health is very, very important, and we want to discuss with an expert all about it. We have Dr. Hasham Varwani in studio. He is a consultant cardiologist at the Aga Khan University Hospital, and let's get into the meaty questions.
Yes. So, Dr. Hasham, tell us, what is the magnitude and impact of heart disease globally and also locally?
So, heart disease is the leading cause of premature death. So it is the most important health concern on the planet right now. Up to 500 million people worldwide live with heart disease. Heart disease leads to more than 18 million deaths a year.
Wow.
So this is a huge problem. It's not only death that we are worried about, but all those people who live with heart disease also face quite a bit of disability in their workplace. For example, there are certain activities they cannot do. Often these are people who are breadwinners for the family, and because of getting heart problems, they are forced to retire early or not do what they could previously do. On the local scene, we've seen a sharp increase in the pattern of heart disease in the last 2 decades. Previously, generally in African countries and in Kenya, we used to have very little heart disease, especially the lifestyle-associated heart diseases. But right now, we're seeing a dramatic increase, and a lot of this has to do, with the lifestyle that we've adopted as a society.
We've heard of the term heart disease. We know heart attacks, etc., etc. But what are the main types of heart conditions that we see, and the pattern of them in society in terms of popularity? Is there a change in the patterns as well?
Yeah, it's important to understand that there's a whole spectrum of heart disease. For example, you can have congenital heart disease where you're born with a defect in the heart, for example. You can have heart diseases which specifically affect the valves of the heart. You can have heart muscle diseases, or you can have problems with the heart rhythm, what we call arrhythmias. But the most important group of heart disease right now is what we call atherosclerosis. This is where cholesterol gets deposited in the coronary arteries and causes blockage of the very important coronary arteries. And this is what we'll probably talk about in more detail.
Yes, that's right. We've got a whole segment on the coronary artery disease. So if that is something that's of interest for you, make sure you keep it to 91.6 FM. If it's not, we're talking about other things when it comes to heart. And as you said, it's the leading cause of premature death. So this is a topic that we should all be aware about. We're talking all about medicine this morning. It's World Heart Day, and we've been joined by a very special guest, Dr. Hasham Varwani. He is a consultant cardiologist at the Aga Khan Hospital here in Nairobi, and let's just jump into some more technical questions.
Correct. We spoke about the coronary artery disease. What exactly is it, and what are the typical symptoms of the coronary artery disease?
So the human heart on average beats 100,000 times a day, religiously, tirelessly. But for it to beat so efficiently, it also needs a good supply of blood to bring in oxygen and glucose to the heart muscle. Now, this supply of blood is brought in through very tiny arteries, which are called coronary arteries. These actually supply the muscles of the heart. They are so tiny, the diameter is around 2 to 4 millimeters. So when these arteries get clogged up by cholesterol over the course of years for various reasons, the blood cannot flow properly to the muscles of the heart, and this is what we call coronary artery disease.
Right.
It can present in different ways, but the most important symptom of coronary artery disease is chest pain. And typically this chest pain occurs when people walk or climb stairs or do any exertional activities, because this is the time when the heart needs to up its game, and it cannot do that because the arteries are blocked. So chest pain, it doesn't have to be on the left side. It can be in the center of the chest, it can be on the right side. But chest pain, whenever it occurs, especially when you're exerting, is a very, very important sign to bring to the attention of your doctors.
Yeah.
So when it comes to that pain, it should be something that you're regularly feeling, or isn't, because sometimes people feel a one-time pain, right?
Right.
Should they be concerned about those one-time sharp pains that you feel in the heart?
Right. So there are many causes of chest pain, obviously, but we generally tell the patients, don't decide whether this is serious or not. Just come to see a doctor.
Yes, that's true. Don't be a doctor yourself.
Yeah.
Or Google.
Yeah, Dr. Google as well. All right, we've got another question that says, what are some of the key tests that you need to know so that you can determine that your heart is in a good condition?
Right, and so that's important, and especially as you approach the age of 40 for most people, it's important to kind of look at your risk profile for developing coronary disease. The typical risk factors are diabetes, cholesterol, and high blood pressure. And all these three are typically very silent. So if you don't look for them, you don't find them. So the typical test that I would recommend anybody to have done, especially if you're just part of your health checkup, is a cholesterol level, is a screen for diabetes, which checks your sugar level, and just a blood pressure check once in a while. A lot of the times people have high blood pressure and they do not recognize that because it's completely asymptomatic. Yeah.
Right.
So, okay, sounds like fairly simple tests that can be indicative of something more. And even if you go do these tests, it gives you some sort of idea about how your health is generally, not only when it comes to heart disease. Today is World Heart Day.
Yes.
We've been talking about all of the questions you have around heart disease, heart health. We're joined by Dr. Hasham Varwani from the Aga Khan Hospital in Nairobi, and let's talk a little bit about heart attacks in particular.
Yes, this is something that everyone, I think, is waiting for. So what is a heart attack and why is it so serious?
So a heart attack is very serious because it can lead to somebody dying within minutes. So this is just to set the scene. Now, what is a heart attack? We talked about the coronary arteries that really are the lifeline for the heart. And when these coronary arteries get blocked suddenly, and usually that happens when you get a clot on top of the cholesterol that's already blocking the arteries, this cuts off the supply to the muscles of the heart, and this occurs suddenly. And at this time, the patient typically would get chest pain, which is quite severe and sudden in onset, and this one doesn't go away. Unlike the previous kind of chest pain which comes with exertion, this one just comes and stays and doesn't go away. The other symptoms that also do happen when a patient is getting a heart attack, some people don't get chest pain, they would get a feeling of acidity, for example. Some people would develop a lot of sweating when this is happening. Some people develop nausea, vomiting, and breathlessness as well. The kind of chest pain that occurs can happen on either side of the chest again, and sometimes it might go to the arm. You might feel that the pain is extending to the arm. It might be extending to the neck or the jaw as well, and sometimes it extends to the upper stomach. So all these are signs of a heart attack. And when you feel you're having any of them, then definitely you should seek some attention.
Right.
Yeah, that was our next question actually. What should you do if you think you're having a heart attack? You need to seek medical assistance immediately, right?
Absolutely. And here time is of essence, because in medicine we say time is muscle. Every minute lost is muscle lost. So you need to number one, get to a hospital as fast as possible, and go to a hospital which is capable of treating heart attacks, right? Some clinics will not help you too much. If you have some aspirin at home, and aspirin is a commonly available drug, you should just chew some aspirin, 1 tablet of aspirin.
Chew it?
Yeah, chew it. And the reason why you chew it is just so that it dissolves and gets absorbed faster into the body.
Okay.
It works much faster than if you were to take an actual tablet. So chew the aspirin and swallow it, and take some water on top of that. That way you can get your blood thin, and this kind of starts the whole treatment process. But the most important thing is go to a hospital that can do an ECG. An ECG is the one most important test to tell you if you're having a heart attack. And at that point now the doctor decides if this is a heart attack, the artery that's blocked needs to be opened up like yesterday. It is that important.
Wow. Okay. So time is truly of the essence in these scenarios, and you shouldn't risk it. There's also this mentality of I don't want to go to the doctor.
Yes.
I'm strong enough to handle this.
That confidence. That's overconfidence more than confidence.
Yes. This is not the place for that one.
Yes.
Maybe just one more question. How do you treat? We've talked about coronary artery disease and heart attacks. How do you actually treat them?
Yes, important, very important question. So the science behind treating a heart attack is to open up the blocked artery. And there are two ways of doing this. One is by giving the patient a special medicine, which is called a clot buster. And this medicine works within minutes to an hour to try and dissolve the clot, which is formed inside, so that the blood flow can be restored. But the more effective way of doing this is doing it mechanically. So typically, for example, you would come to Aga Khan Hospital where we work, and we actually specialize in treating heart attacks. We would rush you to the cath lab, and this is a special room where we do procedures. And while you're awake, we would pass a thin catheter up your arm all the way to your heart and suck out the clot using special catheters and balloons. And the blood flow can actually be restored within the 10 to 15 minutes of your arrival. And this is life-saving therapy while you're awake.
10 to 15 minutes from your arrival point?
Yeah.
That's
very efficient work.
Very efficient, yes.
Oh,
time is money, there we go.
Time is
money, time is muscle.
Yes, time is muscle. We've got all of those new sayings. We're talking all about hearts.
Yes.
It's World Heart Day, a very important day because heart disease, heart problems affect a lot of people. Dr. Hasham Varwani is with us in studio. He mentioned that it's a leading cause of premature death. So this is a topic that is relevant for everyone.
Correct.
Now we've talked about how bad heart disease is.
Yes.
Or heart attacks.
And heart attacks, yeah. So if I was to prevent heart attacks, how would I go about it? And what are some of the things that put me at a risk of having a heart attack?
Right. So I'll start by emphasizing what I said previously, that if you do and develop any symptoms suggestive of a blocked artery, mainly chest pain, then don't sit on it. Seek attention from your doctor, because sometimes you might start off with minor symptoms, and this actually eventually leads to a heart attack if not treated. So that's the first thing. But the second thing is now to try and modify your risk to reduce your risk of developing heart attacks and heart disease. And usually we can't pinpoint a cause of heart attacks, and that's why we talk of risk factors. So what are the risk factors of developing a heart attack? One is if you have high cholesterol levels. Secondly is if you have diabetes. Thirdly, if you have high blood pressures. All these three potentially are asymptomatic. You might not feel anything. Again, this is important then to screen. So as you approach the age of 40, make sure you pay a visit to a hospital so that they check for this. Again, there are other things, other risk factors such as family history. Some people just have a strong family history of developing heart attacks, and they need to be extra careful. Smoking is the biggest sin when it comes to heart disease. Smoking is the most modifiable habit that will prevent heart attacks, right? So all these are preventive measures that you can take, everyone can take, and it's important to spread the message as we connect with the heart today on World Heart Day.
Well, that's what we're doing right here. You've heard the message. You've heard what you can do to prevent heart attacks and other heart conditions. And now let's go on to the questions. I've got a WhatsApp message from Hina who's talking about fluid retention and heart problems. Is there some sort of a link there? What's the story behind that?
Yeah, there's several causes of fluid retention. Potentially liver problems, potentially kidney problems. Can cause fluid retention, but heart failure, which is a condition where the heart muscle is weak, can also lead to symptoms of fluid retention, and patients would get swelling in the legs, they would get swelling within the abdomen, they might get breathless as they walk. So all those are potential symptoms of heart failure, and when you have them, then you should see a doctor to get a bit of blood tests and heart tests done.
Yeah, fair enough. And we've also got one more question. Apart from blood tests that you're mentioning, what are the physical tests for scanning or for routine checkups?
Right. So one of the most important tests is called a stress test. And a stress test is when we put you on a treadmill and really stress your heart. People think they are fit, but when you actually put them through the stress test, then you realize how fit they actually are. So this is a test where we record your heart activity as we make you walk on a treadmill and eventually run. And if there's any potential problem for the heart, we are able to detect it earlier on. Other tests of the heart include doing certain scans of the heart, which look at blockages within the artery. These are called CT scans, which look at how much cholesterol and calcium is deposited in the arteries. And this is a marker of your risk of developing heart disease in the near future.
Yeah. So just to reiterate that, sometimes when you feel that, oh, you know what, I gym a lot, nothing can happen to me, you might not be fit. You might just be bulky, you might have the muscles, but you might not be fit. Because I've seen that happen in the past, where you'll see someone who's so lean, muscular, can't climb a mountain. And then someone who's obese is just walking right up that mountain.
Absolutely. Cardiovascular fitness and physique is very different.
Yeah.
And in the same vein, cholesterol and obesity are very different things. Somebody might say, I'm very thin and lean, I cannot have high cholesterols, and that's completely because cholesterol is the amount of fat in the blood, and this is what is dangerous and gets deposited in the arteries. So the only way you can know whether you have high or not is by getting a blood test done.
Right.
Well, there you go. We've talked all about the tests, the symptoms. You've learned about heart disease, heart attacks this morning. Remember, it is World Heart Day. There's no better time to learn about it. Thank you so much, Dr. Hasham, for joining us this morning.
Thank you for having me.
No worries. It's been an absolute pleasure.
Yes.
I'm sure you've helped a lot of people. You can find him at the Aga Khan University Hospital in Nairobi. He is a consultant cardiologist there.